Acromegaly is a condition characterized by an excess of growth hormone in adults, typically caused by a pituitary adenoma. Acromegaly is a rare but serious medical condition characterized by the abnormal and excessive production of growth hormone, GH, in adults. This condition primarily results from the presence of a pituitary adenoma, a non-cancerous tumor located in the pituitary gland, a small gland at the base of the brain. The pituitary gland plays a crucial role in regulating various hormones, including growth hormone. Normally, growth hormone is responsible for stimulating growth, development, and maintenance of tissues and organs throughout the body. In individuals with acromegaly, the pituitary adenoma causes an overproduction of growth hormone, leading to a variety of physical and physiological changes. Here are key aspects of acromegaly. 1. Pituitary adenoma. The majority of acromegaly cases are attributed to the presence of a pituitary adenoma. This tumor is typically benign, meaning it is not cancerous. However, it can cause significant health problems due to its impact on hormone regulation. 2. Excess growth hormone production. The pituitary adenoma stimulates the excessive secretion of growth hormone. Unlike normal growth, which occurs during childhood and adolescence, acromegaly causes continued growth in adulthood. This results in the enlargement of bones and tissues, particularly in the hands, feet, and face. 3. Clinical manifestations. Acromegaly leads to a range of clinical manifestations, including enlargement of facial features, such as the nose, lips, and jaw, thickening of the skin, coarsening of facial features, enlarged hands and feet, and changes in joint function. Internal organs may also be affected, contributing to cardiovascular, respiratory, and metabolic issues. 4. Gradual onset and diagnosis. Acromegaly often has a gradual onset, and individuals may not recognize the symptoms immediately. The diagnosis is typically made through a combination of clinical evaluation, hormone level testing, especially for insulin-like growth factor 1 or IGF-1, and imaging studies, such as magnetic resonance imaging or MRI, to visualize the pituitary gland and adenoma. 5. Impact on health. If left untreated, acromegaly can lead to serious health complications, including cardiovascular issues such as hypertension and cardiomyopathy, respiratory problems, joint pain and deformities, diabetes mellitus, and an increased risk of certain cancers. 6. Treatment. The primary goal of treating acromegaly is to reduce and normalize growth hormone levels. This is often achieved through surgical removal of the pituitary adenoma, a procedure known as transsphenoidal surgery. Other treatment options may include medication to suppress growth hormone production or radiation therapy in cases where surgery is not fully effective. In summary, acromegaly is a condition characterized by the excessive production of growth hormone in adults, primarily due to a pituitary adenoma. Early diagnosis and appropriate treatment are essential to manage symptoms, prevent complications, and improve overall health and quality of life for individuals with acromegaly. Findings. Common findings include a large tongue with deep furrows, frontal bossing, coarsening of facial features with aging, a deep voice, excessive sweating, diaphoresis, hypertrophic arthropathy, impaired glucose tolerance, insulin resistance, hypertension, left ventricular hypertrophy, and heart failure with preserved ejection fraction, which is the most common cause of death. In children with acromegaly, the excess growth hormone leads to gigantism, characterized by high linear bone growth due to unfused epiphysis. Diagnosis of acromegaly involves observing high serum IGF-1 levels. Another method of diagnosis is failure to suppress serum growth hormone following an oral glucose tolerance test. Another method of diagnosing acromegaly is identifying a pituitary mass on a brain MRI. Treatment. The primary treatment of acromegaly is the surgical resection of the pituitary adenoma. If not cured, alternative treatments include using octreotide, which is a somatostatin analog, pegvisomant, which is a growth hormone receptor antagonist, or a dopamine agonist like cabergoline.